Recreational water illnesses have been on the rise in Wake County and surrounding areas over the last several years. Here in Wake County, the Environmental Services Department is working to help track recreational water illnesses. Today we're joined by Kathryn, an environmental health specialist. Kathryn, why don't you start by telling us exactly what a recreational water illness is?
Recreational waterborne illnesses are potential illnesses that anyone could contract when coming in contact with fresh water. They exhibit themselves such as like diarrhea, gastrointestinal illnesses, skin and respiratory infections.
So Kathryn, exactly what is the county doing to help keep swimmers safe?
The Wake County's recreational sampling program follows the EPA recommendations by testing for E. coli and enterococci bacteria because of their strong correlations to waterborne illnesses. When these bacteria are high, it shows a higher potential of other microorganisms in the water that could potentially harm swimmers.
From time to time, people really ask us this question, but how exactly does the testing process work?
Well, we take 2 samples at each location, each sample location of 100 milliliters, and then we keep it on ice for no more than 6 hours. We take it to the lab and inoculate it with a reagent, in which we incubate that for 24 hours, and then we're able to read the sample and know the most probable number, and that tells us if we have exceeded the fecal indicator bacteria limit set by the EPA.
What happens if a sample exceeds the EPA limits?
If the sample exceeds the recommended limit, we immediately contact the beach manager and close the area, and we commence resampling. We have to have 2 clean samples no sooner than 24 hours apart in order to reopen the beach. The reason we close the beaches is because you're having a swimming area, you're more likely to go underwater, and that's the most common route of pathogen is incidental ingestion. So when we close this area, boating's fine, fishing's fine. We just try to lower the risk to the public.
Finally, Kathryn, what do people need to know before they go swimming at Beaver Dam or any of the other recreational areas in Wake County?
Check our website at WakeGOV.com. There's a recreational water page. You can look at all our locations. You can see if it's open or closed. That's up to the minute, no problem. And then you can also scroll around and find the previous sampling results, as well as how to contact the beaches and camps directly. Also, we'd recommend that you don't do any swimming directly downstream from a stormwater outfall. You wash with soap and water after swimming, and you just don't drink the water.
Kathryn, thank you so much for taking the time to be with us.
Thank you.
Lake Benson Park in Garner is a very popular attraction every summer. Today we're joined by Commissioner Lindy Brown. Thank you so much for being with us.
Thank you for having me, and what a beautiful day. The sun is out, the water looks great. I'm just excited to be here.
Well, it is a beautiful day. What we're talking about today is recreational water testing. One of the Board of Commissioners' top priorities is public safety. Commissioner Brown, one of your top priorities we know is public health. Can you tell us just a little about why that is so important to you?
Let me just say, for those that are not familiar, Sarah, I am a clinical social worker, and in saying that, yes, I have a mental health background, but I also have a public health background. And in that being said, the waters and the environment is extremely important, particularly when you're talking about citizens and their health. And I will tell you right now, so many people will be jumping in the waters to cool off, especially on a day like today that's 90-some degrees, and they may not realize that there may be bacteria that's built up in our water resources, and as a result, they may become sick. Maybe have bacterial infections as a result of that, maybe some skin infections as a result of the bacteria that's in public water streams.
We just spoke to Kathryn, one of our environmental health specialists. Commissioner Brown, can you talk to us about why it's so important to reduce the spread of recreational water illnesses?
Well, it's extremely important. Again, we want to make sure that the public, when they are exposed to our waterways, that they do not have any bacterial difficulties that will lead to additional health problems. And most of the times, people don't realize that there could be intestinal problems that will occur as a result of their exposure in our water streams here in Wake County. That's going to lead, particularly for our young kids that are going through summer programs right now. All they're excited about is just jumping in the water, Sarah, and don't realize that they may get a stomach virus as a result of the bacteria buildup, which will lead to other intestinal problems. And even our seniors who just want to come in and stick their feet in the water, they may incur some other health problems as a result of the bacteria. So it's important to keep our water streams throughout Wake County clean.
As Kathryn mentioned, occasionally there is the need to close one of our recreational waterways within the county. Can you talk to us some about why it's so important for people to heed those warnings?
I strongly encourage the public to monitor our website, as I indicated, for future openings, because we want to maintain our open water spaces for them so they can enjoy the summer.
Thank you so much for being with us.
Thank you for having me, Sarah, and I look forward to talking to the citizen again.
Thank you. If you'd like more information about the recreational water testing program, you can visit WakeGOV.com/waters/recreational water.